here is a soldier who has been shot in the forearm, and he's been triaged and brought back to the field hospital. So what we're going to do is we've examined the wound and we realize that it needs to be amputated. So we're going to assemble all of our equipment. He has a tourniquet on, and the tourniquet has stopped the bleeding. And we know that the arm has to be amputated because the bone is shattered and it cannot be repaired. So with this tourniquet on, we have been able to stop all of his bleeding. And we're going to administer anesthetic. The anesthesia that we're going to use here is going to be chloroform, and chloroform was used by both armies. One of the misconceptions of Civil War medicine is that there was no anesthesia. Well, over 99 or 98% of all of the surgeries done in the Union Army were done under either ether or chloroform, and about 95+% in the Confederate Army. So we're going to administer the ether. We have an ether cone, and what we're going to do is not having an anesthesiologist, because that hadn't been developed yet as a medical practice, we're going to put this cone over, and we're going to administer that until he becomes sort of delirious. Now, there's three things that the anesthetic is going to do. It's going to relax the muscle, so it's going to make it easier to cut through. It's going to give him amnesia, so he will not remember the operation. And it's going to be painless. He's not going to feel any pain, so he's not going to jerk up. One of the most important things, though, is the relaxed muscle. It makes it much easier to cut through. Now, our physician will take over, and I will monitor the anesthesia.
Did you want to cover why we had to amputate?
I did.
Okay. I didn't know if you did or not. All right, so what we would do, first of all, we had to make sure what we have here is actually a broken bone. There's no repair to this.
Okay.
Due to the fact once it goes through, it shatters the bone, and it's usually about 2 to 3 inches each side of the penetration of the hole. We would have to take our fingers in, go in through, feel up to find where it's good bone. With our finger, once he's passed out, we would have to take this double-sided knife here. It's called a Caitlyn knife. It's there sharp that way for 2 reasons. Don't have to switch it and make our cuts.
Okay.
We would do that, make a flap amputation and pull the skin and muscle all back to where beyond the good bone, and then we would saw it off. Unfortunately, I'm gonna have to do a guillotine cut today because that's the way we're set up for. Just go like that and that, it would be done. He hasn't.
No, he's out.
So he's out good. He doesn't seem to be acting too bad. Okay. Now, this is called a Capulet Amputation saw. It is mainly made to do a cut in forward motion. For that, we would actually do 3 to 4 good strokes to saw a bone off.
Oh.
Try to get it away from the coat. Even better.
Whoa.
2 good ones. And as you see, that's how common this was.
That's it.
I forgot to put my instruments for it. I did that for this one. All right, now, once we got the I had them all right here. Did I move over here? I will move over here. Sorry. I had back, sorry. Okay. All right, now we would actually release the tourniquet. Because actually when you cut the bone, the skin in that, all your veins and arteries will retract. So once we do that, we have to take and release this, find our bleeders, pull them out with this tenaculum to take and get a hold of them. As you see, there's some. We'd have to get one here. We'd hook it with this, pull it out. Then we would tie off that bleeder loosely, leaving a piece probably 6 or 8 inches longer. You'd work on and around, you keep going to get all of them done so they quit bleeding. We would use surgical soap in this war. Both North and South use that. During the blockades, the South found out the fact that they could actually boil horsehair or mule hair, and it would be compliable and actually good to work with. For that, once we got done with all those bleeders, we could take that loose. And all you'd have is just the oozing of the blood and the muscle that's in there. We would take the flap, bring it back over, leaving all the sutures out, sticking out just a little bit. It would not be a real good tied flaps. They would be loosely done because later we'll pull all the sutures off because we don't have dissolving sutures. Then we'll close it all back up later. So what first we would grab would be a bunch of blanket lint that the ladies had been doing to absorb the blood.
Mhm.
We put them right over top of that. We would take this bandage here called a Maltese cross or speed dressing, put that on. And then we have a bandage here like this. We would actually go around. And it's made special, so when we get to the end, we actually have two tails.
Mhm.
Want to go this way, want to go this way. And we would tie it off. Then he would be sent to a recovery area to be checked on every hour or two. And then after a day or so, we would go and check on him, make sure what the sutures were like. If they were loose, they're able to be pulled off.
Okay.
Probably by the second day, for sure, they're all pulled off and good because all the arteries have healed. Then we would go back and re-sew that back up tight, so he's ready for his prosthesis.
All of the wounds would get infected because we didn't know anything about germ theory. We had no antiseptic. So we're going to look at the pus that's coming out of the wound. And there's two types of pus. There's white creamy pus, which is called laudable pus, which means, it's a Latin word meaning praiseworthy, and it means that the immune system is working. If the pus is yellow or green and it stinks, that's called non-laudable pus. It's not praiseworthy. And you'll start to see stridations that will come up when you take the dressing off. You'll see stridations of infection. And we would then go in and do a secondary amputation a couple of inches higher. The checking of the pus and documenting that showed that about 86% of all of the soldiers that were on an amputation table survived to go home. That is phenomenal for not having IV fluids, blood transfusions, antiseptics, germ theory, not washing our hands.
The
No.
only time we'd wash our hands is if it got so bad that we couldn't move it. We would have a keg of water here. It was probably blood red by then, just to get the blood to come off our things.
So you
That
can
would
get
be
the
only time.
dexterity back.
So we can still move. Any patient we found that came to the table today had a 20% survival rate on the first day of it being here for surgery over the next day. And then so on. Every day you lose about 20% survival rate. And you gotta imagine, we'll have 500-600 after a battle.
The Battle of Manassas, it took them several days to get all the wounded off. When Jonathan Letterman took over as the medical director of the Army of the Potomac, they had all the wounded off the battlefield within a few hours and had them on their way to different hospitals, to different field hospitals, and to different convalescent hospitals.
Okay, I'll take picture of these things also.
This is a Capulet Amputation Kit. This would have been given to all of the surgeons in the Union Army. They would have gotten a kit like this.
I know, that's a comfortable
They have a
place to
capital saw,
That's what I know.
the different soft tissue knives, and the different types of scalpels, because they did do other kinds of surgery also. We would do bullet extractions where you did not have to amputate. We could take a bullet extractor and we would probe around to find the bullet in the arm or the leg, and then we could, once we found it, we could go in and we could pull that out and then suture this back out. So we also did dentistry. We had
They're down there.
we had a tooth elevator. We had a tooth key. If you had a missing tooth next to it, we could put that in and just pop the tooth right out. And we had a toothbrush, which most of the soldiers did not have, but we tried to teach them dental hygiene.
Okay. Thank you very much.
That's
Quite
all right.
Welcome.